Welcome to COVID-19 Compliance Officer Training Program. This program has been developed by the Citrus Academy. This program then is aimed particularly at workplaces within the citrus industry, but we are hoping that it would be helpful for anybody. It is based on guidelines and directives that have been put out by the Department of Employment and Labour and by the Department of Health. So this should be applicable to all workplaces in South Africa. But as I said, it is then particularly focused on the citrus industry. This presentation forms part of the resources made available by the Citrus Academy, specifically then for workplaces in the citrus industries to assist them with implementing COVID-19 risk management measures within the workplace. It is also one of the resources that is used for an e-learning program that was developed to allow COVID-19 compliance officers to be certified as such. That e-learning program, if you would like, you can register for that on the website of the Citrus Academy. But watching this video is, of course, free. Before we get then into the nitty-gritty, let's just first of all a little bit of a disclaimer, just to say that this training program, the recommendations, the opinions, the information that is contained in this program was put together from a variety of sources, from guidelines, directives, and so on issued by the government to information that was made available by organizations such as the Center for Disease Control in America. Although we are reasonably sure that everything we say is true and correct according to what is known right now, we do not take responsibility for anything that you implement and do in your workplace as a result of this training program. It is completely in your court. The Citrus Growers Association, the Citrus Academy, we do not accept any liability. It is up to you to make sure that you are informed and that you know the regulations and the legislation that is applicable. So before then we look at this particular program, we need to understand the principle that we used in putting together this program, putting together workplace guidelines. This is not about government bashing. This is not about laying blame or saying some people are more responsible than others. There's only one enemy here, and that is COVID-19. And it's for the government, for the public, for employers, and for workers to stand together and to stop COVID-19. That is what this is all about. This is not us being against each other. This is all of us against this virus. What are we going to be covering during this course? We're going to look at pertinent facts, at what the government regulation says. We're going to look at how do you go about risk assessment and mitigation within your workplace? How do you identify critical control points and actions? And then we're going to look at best practice. So that is all to inform you about what is happening, what are the regulations, requirements around mitigating risk of COVID-19 transmission in the workplace. I want to help you, give you some practical advice, templates, checklists, resources, scripts, anything that we can do to help you to make this easier to implement. And then, of course, motivation. It can be a pretty lonely job being a COVID-19 compliance officer. And I can almost guarantee that you won't be the most popular person in your workplace, because this is about getting people to do things that's not particularly fun, getting people to comply with measures, regulations, and so on that is outside of what is normally required of them. But it is necessary, it is essential, it saves lives. Therefore, it is important that you are motivated to do this job and to do it well, and that you're in a position to feel that you're able to lead people in your workplace, that you can control the situation, that you can communicate positively, and that you take the responsibility of reporting and keeping people informed. So let's look first of all at the facts. What is known? First of all, we know that COVID-19, now let me just say, I know that most of us already know just about all of this, okay, but let's just revise so that we're all on exactly the same song sheet. We know what we know. There's a lot of fake news out there, there's a lot of stories out there, but this is what we know for a fact. First of all, COVID-19 is a viral disease. It is a coronavirus, so it is a typical flu virus. It is spread through respiratory droplet. It is carried through the air. Because it is carried through the air, ventilation aids with the dispersion of the virus. It can remain on surfaces for a short time The pathway of infection through surfaces is a viable pathway, but that is really a very, very small probability. It is a much greater probability that you will get infected through airborne respiratory droplets. It is denatured by sunlight, soap, and water. What are the symptoms? That has been updated since we first started looking at this. In fact, fever is no longer one of the main symptoms of COVID-19, according to the NCID. It is now, as it was from the start, a dry cough, shortness of breath, a sore throat, and then now the fourth major symptom is now a loss of smell or a loss of taste. So those are the major symptoms of COVID-19. Secondary symptoms is still fever, body aches, redness of eyes, nausea, vomiting, diarrhea, fatigue or weakness, and then headaches. People who screen only for temperature, that is only a secondary symptom of COVID-19. What they should be doing is they should be asking you whether you have shortness of breath, a sore throat, whether you're coughing, or whether you have lost your sense of taste and smell. So those are the symptoms. How do we prevent getting infected? This is what you need to do. Do not touch other people. That is a major pathway for spreading respiratory droplets. Do not touch your face. Wash your hands regularly. It has been found in studies that washing hands is much more effective in reducing infection through surfaces, for instance, than actually cleaning and disinfecting the surfaces itself. So if people were to just wash their hands regularly, that pathway of infection will become even less likely than it is already. Clean surfaces regularly, of course, and disinfect them. If you are going to cough or sneeze, you want to do that into your elbow, not into your hands, because then you just cover your hands in respiratory droplets, but into your elbows. And then, of course, wearing a mask. That is the most effective way in reducing your risk of contracting a COVID-19 infection. What else do we know? We know that some people are more vulnerable than others, not for getting infected with the virus itself, but for developing a serious case of COVID-19. Some people are definitely more vulnerable than others. We will look at vulnerable people a little bit later on and discuss the factors that are in play there. It is more prevalent in winter. Then the last thing, there is, of course, treatments available now, and there's vaccination available. There's no cure as such, but there definitely are very effective treatments. We have vaccinations available, and on that point, what are the facts that we know about vaccinations? Not what is the fake news, not what does it sound Facebook, not what is the latest rumor that is doing the rounds. What are the facts about vaccinations? In South Africa, we are currently using Pfizer and we're using Johnson & Johnson. Both of these are mRNA vaccines. Now, what does it mean if something is an mRNA vaccine? It means that it contains the RNA coding for the spike protein, this little guy that is on a coronavirus. So what it does is it introduces into your body a small part, not the virus, a small part of the coding for one particular part of the virus. What does your body do? When you introduce that little bit of the RNA coding into the body, your body immediately recognizes that as foreign DNA, as a foreign particle. It develops antibodies, it attacks that spike protein, and it develops antibodies against it, and it develops T cells against that. Now, some of us already have T cells naturally, but the vaccination then helps your body to further produce these T cells. If you are then exposed and infected by the virus, doesn't mean that you can't get infected, doesn't mean that the virus will never come near you. Unfortunately, it doesn't put a great big red stop COVID-19 sign on your forehead that says don't even come near me. It will still infect you, it will still get into your system, but your body will immediately kill it. The antibodies, the T cells that are there, your body is therefore primed then to immediately attack the virus if you are infected by it, and it kills it. So that is how mRNA vaccinations work, and that is why they are so effective. How is it that it was developed in such a short time? Two reasons. The only thing that you need is the coding for the particular part of the virus that you want to code for, that you want to include in the virus. C viruses, coronaviruses were known. People have been studying them for 50 years now. MERS is a coronavirus. SARS was a coronavirus. The common flu, or some of the common flu viruses, are coronaviruses. So people have been studying them for 50 years now. They were familiar with the DNA for this virus, and therefore it really was not a lot of work to identify the particular coding for that spike. It therefore was easy enough for them to identify what they needed to do. Of course, there were trials that were run, but trials were also a lot quicker and a lot easier because there were so many people, so many test groups that could be used. So these are the reasons why we were able to develop a vaccine in less than a year. It is safe, it is effective, this has been proven. Almost 1 billion people has been vaccinated around the world to date. The side effects that they do see are from people who have allergies to particular components of vaccines. So all vaccines contain substances that is used to stabilize the vaccine and to give it some shelf life. If you have in the past had an allergic reaction to another vaccine, like for instance, the measles vaccine, you are likely to have a small allergic reaction to the coronavirus vaccine as well, but it's not the vaccine itself. It's not the RNA, the DNA, the coding that you're reacting to. There's the other components of the vaccine, which is common amongst many vaccines. These are the recommendations at the moment. These are the only contraindications for the vaccine. If you're under the age of 18, they don't recommend it for pregnant women further than 28 weeks, and then for people with known vaccine component allergies. Okay, so what did the government do? First of all, they put us all into lockdown. I'm sure you will all remember it fondly right now, all of the measures that have been put in place. Then about April this year, vaccines came into play. The Prez himself got vaccinated. What then are the other things that the government did is they put out a lot of paper, guidelines, regulations, directives, directions. They put out, we will look at each of these in a little bit more detail a little bit later on so you understand the content of it, but the most important one that we need to be paying attention to is this. This is the consolidated direction for occupational health and safety measures in the workplace. So this applies particularly to workplaces. This is the latest version that we see in front of us right now. As you can see, it's hot off the press, and it was issued on the 11th of June. And this is then where we stand and the one that we all have to adhere to now in workplaces. Now, let's just look at that a little bit more. It's important that you understand the scope of it. Of course, as a COVID compliance officer, you need to be very familiar with all of these pieces of paper, and in particular with this one, with these directions for workplaces. You need to know this inside and out, and you need to make sure that you comply to everything that's in here. So let's just have a little bit of a look so you can understand the scope. The first thing that is required by these directives is that workplaces need to undertake a risk assessment. So you need to go and look at your particular workplace, do a risk assessment. This risk assessment needs to give effect to the minimum measures in this direction. And then the other thing that you need to do during your risk assessment, and this is new in these directives, is a workplace, an employer now has the right to decide whether it will make vaccines compulsory for workers. It will mostly be, and the intent is that will apply to particular workers. So the idea is that employers will go and look at their particular workers and decide based on operational requirements and on things such as worker vulnerability, whether there are particular workers for whom they would like to make vaccines compulsory. Within 21 days of the issuing of this particular directive, so this will be on the 1st of July, employers need to inform the department whether they intend to have any compulsory or mandatory vaccination in their workplace, and they need to identify the people who vaccinations will be compulsory. What else does it say? Based on this risk assessment, we need to then develop a workplace plan that says, what are we going to do in our workplace in order to mitigate the risk of COVID? First of all, it has to outline protective measures, and then it has to outline vaccination measures. Protective measures, what does that mean? In the directive, it sets it out, and it comes down to you have to identify your opening date. So this is still kind of written for workplaces that are maybe in lockdown still at the moment, still plan to open. So it says that you need to specify your opening date, but most workplaces are open already. So opening date, and you have to specify your business hours. You have to make a list of the workers that will work at the workplace and those that can work from home. If you're going to have a phase in return to work, that needs to be in your plan. In your plan, you need to say how are you going to identify vulnerable employees and who they are. You have to say what measures are you going to put in place to minimize the number of workers in the workplace at any given time, and what other protective measures you're going to put in place in the workplace. You also then have to specify the measures for daily screening, the details of the COVID compliance officer, and then lastly, you have to have procedures in this plan for resolving refusal to work. We will look at refusal to work a little bit later. In terms of vaccination measures, what the guidelines require is that you have to put in your workplace plan how you're going to identify employees for mandatory vaccinations, how you're going to make sure that you are complying with the requirements of these guidelines and of vaccinations, and then whether you are going to implement mandatory vaccinations. Now, in terms of compliance, what the guidelines require, we're going to again look at that a little bit later on in more detail, but what it requires is that you assist your workers to register for vaccinations and that you make it possible for them to go to vaccinations, give them time off, help them with transport if they needed it, so that you enable the process of vaccinations. Okay, then the other thing that is in the guidelines are administrative measures. Now, here there are quite a few of them. So what this basically says is what a workplace needs to do is you have to have your risk assessment, you have to require disclosure of health status so that you can identify vulnerable employees. You have to notify workers about what is in these guidelines, instruct workers to stay at home if they're not feeling well. The COVID compliance officer will look at a little bit more detail just after this slide so that you understand exactly what your role will be. You have to monitor, supervise the implementation of the measures. You have to minimize the number of workers at the workplace, minimize contact between workers, raise awareness around and inform workers around COVID-19, the disease, and vaccinations. Then what do you do if somebody tests positive? We will discuss that in much more detail a little bit later on. You need to help with vaccine registration, and you need to give people time off to get vaccinated. There's two other administrative measures, but they are rather minor. And then the fourth administrative measure is you need to do data submission to the National Institute for Occupational Health. We will look at that later in detail as well, the kind of data that you need to submit and how you will do that. What do you do as a COVID-19 compliance officer? That is in the regulations. Every workplace has to appoint a manager as a COVID-19 compliance officer to oversee the implementation of the plan, to oversee adherence to the plan, and to address any concerns raised by workers or by worker representatives. So that is your job, to implement the plan, to oversee adherence, so to make sure that everybody do what they're supposed to do, and to talk to people to make sure that the information are being communicated to workers. So these are then the other sections, just as a final little overview of the regulations. We look now at the administrative measures, and then of course the regulations then specify the measures with regard to social distancing, symptom screening, sanitizers, disinfectants, cloth masks, and so forth. And then also just some administrative issues, right? How do they amend and when do they withdraw, and when do these directions come into effect? So that's basically what the directions cover. It's important, as I said, as a COVID-19 compliance officer, that you're familiar with these directions. It's really not hard reading. It's not that long. It's only 25 pages, and really isn't tough reading. So please make sure that you're familiar with this, that you read it through, and that you understand what this requires. Okay, so refusal to work. We do need to look at that. What does it mean? Workers now have, as per these directives, they have the right to refuse to work. So if any worker feel that what is being required from them will put them at risk of being exposed to COVID-19 infection, they have a right to refuse to do that task. They don't have a right to refuse to come to work. They don't have a right to refuse to ever do anything again. They have the right to refuse to perform particular tasks that they believe will put them at risk. As an employer, you must attempt to resolve these issues, to understand where the worker is coming from, why they are saying that there is a risk in the particular task that you're requiring of them. If you cannot resolve this dispute, if you cannot come to an agreement, you can consult a Department of Employment and Labour inspector. Whatever that inspector says, you are then obligated to follow the instructions and the decision of that inspector. The directive also states that no person may benefit from or promise benefit to another for not refusing to work. So if a person decides that I'm at risk, you can't go and bribe that person and say, oh, come on, I'll give you $50 extra. That is against this regulation. And remember, this regulation is empowered through the Occupational Health and Safety Act. You will be breaking the law, in effect, if you attempt to bribe someone into working if they believe that they might be put at risk. You also may not threaten, dismiss, discipline, prejudice, or in any other way harass anybody for refusing to work. And if a worker feels that clause have not been complied with and that they have been put at risk unnecessarily, or that you harass, threaten, dismiss, discipline, prejudice them, or that you try to bribe them, they can take you to the CCMA and to arbitration. All right, so before we go on to looking at the workplace itself, I just want to quickly run through the other 7 guidelines, regulations. They are referred to in footnotes in the directive. So they are empowered through the directive, but they are mostly only guidelines to assist you to further implement measures in the workplace. So this one is for symptom monitoring and management of workers. So this has got to do with screening. It identifies the symptoms of COVID that you need to be on the lookout for, then also set out the particular measures that you need to implement with regard to screening, and then also have very handy templates for symptom monitoring, etc. Then we have a guidance for vulnerable employees. How do you identify them? What is the procedure that you need to follow? This is what do you do if somebody in the workplace tests positive? This is clinical management guidelines. So this is put out by the National Institute for Communicable Diseases. And this then sets out what the procedures, what the correct protocols and procedures are for testing for COVID, and what is the correct procedures for the clinical management of the disease. There's a lot of doctory stuff in there, so it's not all that. It's not necessary for you to learn everything that it says in there, but it is very useful in terms of looking at things like symptoms and the approaches to or identifying if people are getting seriously ill. It is useful information. This is then a guidance on routine and deep cleaning in workplaces. As I said, very minor probability of COVID being transferred through surfaces. It is unfortunately something that people got very much hung up on. They seem to think that that is your biggest chance and that immediately we need to perform an exorcism on any workplace where a person has tested positive for COVID. This is, of course, absolute nonsense and mostly, I think, promoted by people with cleaning companies. But there are guidelines out for how do you do routine cleaning, what is the correct way to do routine cleaning to ensure that you do keep a clean workspace. This one then is the guideline for the submission of health-related data. We will look at that in a little bit more detail right at the end of this course, just looking at what kind of data you need to be submitting and how you ought to do that. This is the guideline document on that, interesting reading, and then just from the Department of Trade, Industry and Competition, just guidelines on fabric face masks. Okay, so how do we then do workplace risk management? Now, of course, we've now spent a lot of time looking at guidelines, regulations, and so forth, but the reason why we do this is, in the second place, yes, to comply with guidelines, regulations, and so forth, and because the government expects you to, and because the government inspector is going to come, and if you don't have the stuff, you're going to get into trouble. But firstly, and most importantly, we implement workplace risk management and workplace measures in order to protect the people that work in our workplace, to keep everyone safe, to keep the wheels turning, to make sure that we remain productive, and to make sure that people are not unnecessarily placed at risk. This is the main reason. This is why we do workplace measures for COVID-19, is to protect the people that work for us and the people that work in our workplace. That is why we do it. Not because the government says so, but because we know it's the right thing to do. How do we go about it then? Well, how do you do workplace risk management? You need to go and look at, ask some very serious questions. Critically look at your workplace and ask yourself, where are people most likely to congregate? So where are people most likely to come into too close physical contact? How do I keep the number of people at the workplace at any given time to a minimum? How do we set up the workplace so we limit the risk of infection? We now understand how COVID-19 spreads, that it is through respiratory droplets, it's through the air. How do we set up the workplace to limit that risk of infection? How do we, if people do come into contact, how do we protect people from being infected by others? What kind of personal protection can we help people with? How do we identify people who are vulnerable to develop serious illness, and how do we accommodate them and make sure that there's special protection in place for them? And how do we make sure that people are informed about COVID-19 and that people know what is expected of them in the workplace, what they can do, what they can't do in the workplace? Shortly, what are the critical control points and actions that we need to look at in our particular workplace? So this is what we suggest. This is one way to look at critical control points and actions. You can, of course, come up with your own structure. This is a useful, generally applicable kind of structure that should assist you in guiding your thinking around identifying critical control points and the actions that you need to take in order to address risk at each of these critical control points. First of all, preparation and setup. You need to get your house in order. You need to make sure that everything is in place for you to be able to implement particular measures. Measures that you need to implement will have to do with transport and access control, in particular, workstations, workplace movement, and common areas. So getting to work, getting into the workplace. This then has to do with when you're in the workplace, how do you then act? How do workers then behave themselves? What do they need to do? How do you put person protection and hygiene in place? And then lastly, communication. So those are the actions that you need to look at. Those are the four areas for which you have to go and identify actions. How do you do daily inspections? Dealing with at-risk persons and positive cases is a very important aspect of risk mitigation. And then record keeping and data submission, the most interesting part of your job, I'm sure. This is how we break it down. It is a useful way to look at it and a useful way to approach it, and should help you to cover everything and to think about everything that you need to think about. So first of all then, preparation and setup. There's a few steps involved in that. First of all, you have to develop that risk assessment and the workplace plan. That is what we were just talking about. The risk assessment has to do with identifying those critical control points. You need to look critically at every control point, look at what can go wrong there, what do we need to do to manage that risk and to mitigate that risk. You need to document your control measures, you need to put it all into policies and procedures, and you need to consult. The directive requires that, and it is a really good idea to consult your workers, your health and safety committee, if you don't have one, health and safety representative in the workplace. If you're unionized, luckily in agriculture we don't have a lot of that, but if you're unionized, consult the union. Make sure that everybody understands the program, that everybody feels the plan, that everybody feels it's their plan, and that everybody buys into it. Don't make this something that is forced from the top down, because then you have already, from the start, you're going to have problems with adherence. So make it something that everybody feels that they've got a stake in. Secondly, as part of your preparation and setup, you need to classify your workers. The guidelines require that. It's also, of course, a very good idea. You want to minimize the number of people in the workplace at any given time. So you want to classify your workers, first of all, by deciding who needs to be at the workplace and who can work from home. There's issues working from home, issues around productivity, management. It is more difficult. You need to look at your middle managers, you look at your team leaders and so forth. If they have staff working at home, there's particular tools that they can use, there's particular approaches that they need to take to managing those people, managing their tasks, to make sure that you maintain productivity, make sure that people understand what this will mean, and make sure that they are prepared for maybe on a longer term and as a more permanent measure, that they are able and in a position to manage people working from home. Yeah, need to enable that too. Please don't leave it up to your employees to sort out their own Wi-Fi and their own stuff at home. It is going to kill productivity if you do that. Think about it carefully. It's going to cost a little bit of money, but think about what the cost of failure is there. If workforce productivity, everybody that's working from home is cut down by half, what will the impact be on your workplace? So think about what is the most effective way for you to ensure that people are able to remain productive when they are at home. Then, if it is not possible for people to work from home, assess whether it's possible for people to work flexi time, whether you can change working hours. Maybe somebody wants to work from 6 o'clock in the morning till 2 o'clock in the afternoon, or maybe they want to work from 10 o'clock till 6 o'clock. Whatever it might be, if you can work flexi time, again, you will be minimizing the number of people at the workplace at any given time. To classify workers and decide what you can do to minimize the number of workers at the workplace. Then identify vulnerable workers. This is extremely important. It's required by the directives, but it is, of course, also very important that you place special attention to those people, those workers in your workplace that are particularly vulnerable, that belong to one of these categories. Over 60s, people who suffer from comorbidities. So comorbidities are things like diabetes, especially if it's untreated diabetes, people who suffer from heart disease, chronic lung disease, asthma, etc., people who suffer from chronic kidney disease, chronic liver disease, and so forth. So people with comorbidities, people who are severely obese, so people with body mass index over 40, people who are immunocompromised, so particularly people who have or have had TB, people who are HIV positive, and then people who have had transplants of some point or another, and who are on medication to suppress their immune system in order to manage that transplant. So it's very important that you must look at these people. Women who are over 28 weeks pregnant are also particularly vulnerable. So those are the 5 categories that you look out for. Now, how do you know whether somebody is in one of these categories? So some of them you should be able to reasonably assess, but the others, such as comorbidities, being immunocompromised and so forth, will require a medical report. Now, the regulations prescribe that the worker's treating doctor needs to assess them and need to submit to you a confidential report. In that, they merely need to state that this person is a vulnerable worker. They do not need to disclose the particular reason. So they do not need to break doctor-patient confidentiality by disclosing that those people have, for instance, asthma or diabetes, etc., if the worker is not comfortable disclosing that to you in the workplace. But they can just state that the person is vulnerable and that they do fall into one of these categories. That document you need to then put into that person's record, and then you need to make special accommodation for people who are vulnerable. You either need to give them isolated workspace, you need to give them special protective measures, you need to maybe allow them to work from home, change their working conditions, how their working hours, whatever it is. Help them not to have to use public transport, for instance. So make sure that people with particular vulnerabilities are accommodated in your workplace and that you give special protection to them. Then you need to structure your work teams and shifts. So once you've classified your workers, go and look at your shifts, your working hours and so on. See what you can do. Again, this is all about minimizing the number of workers at the workplace at any given time. Of course, your operational requirements remain very important and you need to base it on that. But you need to then also think about how you can better accommodate vulnerable workers. Fifth thing, the other thing in terms of preparation and setup is you need to think about how are you going to enable vaccination. So you need to promote it amongst your workers, give information through to them, put up posters, pamphlets, everything. Make sure that you are informed about vaccinations. Make sure that you can address fake news that are coming in, stories that people come up with, and make sure that you can that you promote it as far as possible. Assist workers with registration, with registering for vaccination. We will look at a little bit later on exactly how you can do that. And then think about mandatory vaccinations, whether you are going to make any vaccinations for any of your workers compulsory in the workplace. Make sure that you inform the department and that you develop the criteria that you'll be using for that and identify the workers for whom vaccination will be mandatory. Further, with regard to preparation and setup, you need to now start thinking about particular things in and around the workplace. How do we need to set up and prepare transport and access control in order for us to be able to implement workplace measures? Look at your worker transport, see if you need to adapt it, if there's anything you can do to improve ventilation, physical distancing, and so forth in your worker transport. You need to think about worker screening processes, so at access points and at transport points. How do you prepare for that? What documents do you need? How do you set that up? Workstations, workplace movement, common areas. Get a map. That is one of the best things to do. Get a map of your workplace and go and look at how can you limit movement through the workplace? How can you limit contact between people in the workplace? How can you look at common areas to ensure that people can maintain distancing there? How can you manage ventilation inside the workplace? How can you set up workstations so that there's physical barriers between people if they cannot maintain distance? How can you do all of that? How do you set this up in order to implement measures? You need to then also look at stocking, sanitizing chemicals and equipment, and cleaning equipment, chemicals, etc. Go and read up on this. It is very important. There's the guidelines from the department. There's also very interesting information out there about the effectiveness of soap and water as opposed to sanitizing agent, and when sanitizing agent is really necessary, and when it is appropriate to use that. So go and read up about that. Make sure that you're informed and that you get the right stuff and enough of the stuff. Personal protection and hygiene. You need to stock up on your PPE, your chemicals, your equipment, hand wash, all of that sort of thing, paper towels and so on. You need to get all of that and you need to distribute it to your workers. Just in terms of masks, please have some mercy on workers. Some masks are really, really uncomfortable. It's difficult to breathe while wearing them. They're uncomfortable to wear. It is important that you think about what the effect is of requiring people to wear masks 24/7. In most offices now, the workplace guidelines also says as long as your workstation is 1.5 meters apart, once a person is seated at their workstation, they can remove their mask and they can carry on working, and then only put their mask back on if they get up from their workstation to go somewhere, to the kitchen, the bathroom, whatever it might be. But in many cases, such as pack houses and so on, people have to wear their masks all the time because of physical distancing is not possible. Therefore, please go and investigate masks, look at various options, look at if you can find comfortable masks that is not an absolute pain to wear all the time. Remember, what you want to do is you want to enable compliance. You want to encourage people to disclose, and you want to enable compliance. You don't want to make it hard for people to comply with measures. You want to make it easy for them to do that. Then communication, data submission. What do you need to do to prepare for that? Get all your data collection templates, register on the OHSS portal. We'll look at that a little bit later on. Get all of that ready. And then in terms of communication, decide what your message is. In my view, what your message should be is we're doing all of that to protect each other and ourselves. This is why we have measures in the workplace. Not because I say so, not because I'm feeling like Hitler today, not because the government says so, or there's going to be an inspector or whatever else. We are doing this so that we are able to keep each other and ourselves safe. That's why we're doing it, because we care about each other and we care about the workers in the workplace. So clarify your message. Develop scripts. Most of this message is going to be communicated to your workers through their team leaders, through supervisors. Make sure that everybody understands what they need to be messaging. Develop scripts if necessary. Make sure that people understand. Schedule briefing sessions. Schedule just quick team talks every day, every week, just quickly. How's everybody doing? What have you heard? Are you happy? Are we complying? Are we doing what we're supposed to be doing? If we're not doing, why is this? Can we improve it? Can we improve measures, etc.? So make sure that you enable communication and that you make it possible for people to comply with the measures. Then you need to prepare for particular events. You need to prepare your screening assessments. You need to prepare your first aid and healthcare workers and facilities. First aid workers, your healthcare workers need to understand what will be required of them. They need to be absolutely informed about COVID, understand what the symptoms look like, understand what they need to do if there's a person that is at risk in the workplace. Prepare your isolation room. We'll look at what you'll do with at-risk people later on. If there is a person that's identified in the workplace as being at risk, that they develop symptoms, you need to be able to isolate them immediately and keep them away from other people. So prepare that isolation room. And then identify a testing facility. You don't want to be scrabbling around at the point where a person is actually at risk and you have to send a person for testing. You don't want to at that point start wondering where's the closest testing facility and what do I need to do and who's going to pay for it. You want to be able to know exactly what to do, exactly where to go, and exactly how to go about this. So identify testing facilities in your area and know exactly what you're going to do. Okay, so let's go and look then at each of these four particular aspects or particular areas in the workplace that we need to address. Transport access control, we've already quite a bit of this. So what are the measures that you need to implement and that people need to implement every day in order to keep themselves safe on worker transport? So worker transport is transport that is being used by workers to get to work. So the one option is, of course, people get to work via public transport. If they get to work in their own cars, they should be reasonably safe. If they get to work using public transport, that is a particular risk that you need to think about. Best practice there is to make sure that people are aware of the dangers, that they protect themselves while they are on public transport. Open a window, wear your mask, keep your distance if at all possible. Make sure that people don't have to travel at peak times, so they're not in absolutely overloaded vehicles, that they are maybe traveling to and from work outside of peak hours by changing their working hours. That is very helpful. So think about all the ways and how you can mitigate the risk that people being exposed to COVID-19 on public transport. If the workplace itself provide transport, how do you manage that? How do you think about danger of infection from surfaces? So you need to put measures in place to clean the transport vehicles between every load. How do you make sure people don't get infected while they're queuing at transport? Now remember, in terms of access screening or workplace access screening, you can't only screen people. If you provide transport for people, you can't only screen people when they get to the workplace. You need to screen them before they get onto the transport vehicle. Otherwise, they're sitting on the transport vehicle with 20 other people for half an hour before they actually get to the workplace, and then you pick up that they're symptomatic. No. You need to screen them before they get onto transport vehicles, onto your transport vehicle. So you make sure that is enabled, that people, while they're queuing to be screened, while they're queuing to get onto transport vehicles, they maintain physical distance. You need to make sure that you don't allow people who might be at risk or might be symptomatic onto transport vehicles. You make sure that the drivers, that assistants on the transport vehicles are able to and have what they need in order to screen people. Then put measures in place to assist people to maintain physical distance or physical barriers while they are on transport, and then make sure that people are wearing masks. A lot of that comes down to the driver. It is a lot for them to handle. We recommend, especially if you have big vehicles like buses and so on that carry more people more than say 8 or 10 people, that you consider appointing an assistant for every driver, for every vehicle that can go with the driver, that can assist with screening, with cleaning of the vehicle, with ensuring that people are maintaining distance and wearing masks, so that can assist the driver in monitoring compliance on vehicles. Access control. This is now for people who arrive either via public transport or with their own vehicles. This also applies to, this is for workers, yes. So how do we make sure that that workers don't crowd around entrances? So workers, when they get to work, should now be lining up and being screened before they're allowed into the workplace. So we need to make sure that they maintain their distance, that we limit contact between people at entrances. It is very much the done thing now to limit the number of entrances into workplaces and into spaces. That to me seems to be rather counterproductive, because what you're doing is you're forcing more and more people to use the same entrance. So what you're going to definitely get at entrances is crowding, whereas you used to have 5 entrances to allow 100 people or 20 people on average going through an entrance. Now you've got one open and you're forcing 100 people to go through one entrance. Airports, everybody, I do not understand the thinking around that. It is you want to reduce crowding around entrances, you want to reduce the number of people. So rather set up more access points and enable more access points with screening procedures at more access points to ensure that you reduce crowding and that you also get workers into the workplace quicker. You don't want people to share equipment, so make sure that they not all touching the same biometric access system or pen or clipboard or whatever it might be. So make sure that you make that entrance procedure and that screening procedure as easy as possible. Maybe ask questions rather than ask people to complete forms themselves using pens, sharing pens. You need to make sure that the people that's doing access control and screening understand the symptoms, know exactly what to look for, know what are the right questions. As I said before, taking someone's temperature is not screening. That is a secondary symptom. It's not even the major one you need to be looking out for. What you need to look for is how's a person looking? Do they look unwell? Are they coughing? These are the questions that you should be asking. Headaches, body aches, yes, of course, also secondary symptoms, but then sore throat, coughing, shortness of breath, loss of taste and smell, and so on. These are the things people should be screening for at access points. And then, of course, if you do find somebody that are at risk, that you consider to be symptomatic at risk at an access point, what do you do? What are the procedures that you follow? The people who are at those access points doing access control need to understand 100% exactly what they need to do if that happens. All right, so that is now for workers. Then what do we do about public, service provider, customer, and so on, access control? We need to make sure that every person that comes into the workplace is screened before they're allowed access into the workplace. You also need to think very carefully about how far people need to go into the workplace. Really, is it necessary for delivery people to go into your storerooms, or can you have people deliver things to reception or even outside and then have your own workers take it into the storeroom? Do you need people, couriers, for instance, to go and fetch a parcel from somebody in the admin office? Or can they just fetch that from reception? Think about all of these things, all of these pathways, movement pathways through your workplace, and think about how you can reduce the penetration of people from outside the workplace, from members of the public, etc., into the workplace, and how you can ensure that there's minimum contact between your workers and members of the public. Then, of course, you need to screen all of these people at access points. You need to make sure that you can identify people who might be at risk, and you need to know exactly what you're going to do if people are considered to be symptomatic or at risk. You also need to limit the sharing of equipment, these people entering the workplace. Right, so that's what the things that you ought to be thinking around. There might be more things in your particular case, in your particular workplace, but hopefully this will guide your thinking, and this will help you to start identifying all of the risks at these control points and the actions that you need to take in order to mitigate those risks. Then workplace arrangements. Inside the workplace, we've now arrived at work, we've now made it through the access control, we get to the workstation, we get into the workplace. Now, how do we mitigate risk there? First of all, workstations. Think about ventilation, think about physical distancing and barriers. Make sure that work areas are properly demarcated. Get your map out again. Get your drawing of your workplace out again, and think about demarcation. Think about whether people need to be wandering into other people's workspace just to go and have a chat. Think about in a pack house whether the packers need to be wandering into the grading stations just to go and greet their mate. think about all of these things, especially if some of the areas are accessed by members of the public, customers, service providers, delivery people, etc. Think about how do you limit access to all of these various areas and make sure that only people who belong in an area go to a particular area. Get out red tape, put it down on the floor. Laser beams might be overkill, but do whatever you need to make sure that people don't go wandering around and there's unnecessary contact between people inside the workplace. Then how do we keep it clean? In workplaces such as a pack house, that's of course because you should be keeping it clean anyway all the time. So it shouldn't really be a problem to make sure that you have regular cleaning and sanitation inside workplaces like that. But other workplaces such as offices, office spaces, and so forth, there need to be cleaning schedules that needs to be adhered to. You need to make sure that they're clear to everybody, that everybody is clear about them. You should be cleaning between every shift, or at the end of or at the start of every day, wipe down surfaces, make sure that things are clean and neat. You need to think about ventilation, as I said before, all of these things to make sure that workstations are safe places for people, especially if your people are going to be sitting down at workstations, removing masks and so forth. Make sure that you do whatever you have to in order to ensure that they're still protected against infection. Workplace movement, as I said before, limit that. Make sure people don't wander into spaces where they don't belong. Make sure that workplace pathways through the workplace is shortened, limited, that there's limited access between various groups of people while they are moving through the workplace. Especially think about people such as cleaners, messengers, forklift drivers, and so forth that work throughout the entire workplace. Think about how to give them special protection, make sure that they've got sufficient PPE, that they know how to use that, and that they know that they should be wearing that. And then, as we spoke about before, limit contact between members of the public and your workers within the workplace. Do what you have to do. Common areas. This is, of course, one of the great critical control points in all workplaces. Bathrooms, kitchens, canteens, anywhere where people will be sharing space, where people might get too close together, where people will be touching common surfaces, all of these things. Common surfaces, common equipment, the kettle, the teaspoon, the cup, the plate. How do we make sure that we limit the risks that are in these particular places? You can, for instance, consider if you have a canteen where people are scheduled to go to have breaks, take their lunch breaks, etc. Stagger those between various workplaces. Don't have all of your 500 workers in the back house go on lunch at the same time and share that space. Stagger it so that you have small groups of people using these common areas at the same time. Think then also in particular about boardrooms, training rooms, other meeting areas, and how do you maintain physical distancing there. Make sure also that whenever people are in any of these common areas that they are very, very good about maintaining PPE, that they wear their PPE. Talking about PPE, personal protection. How do you protect yourself from other people? Keep yourself safe. Maintain physical distance. Hugging, kissing, touching, shaking hands, so on, out. We don't do that stuff anymore. And especially in the workplace, that just is not allowable anymore inside the workplace. Physical distance, at least 1.5 meters. Staying away from anybody who may be at risk. Anybody that you consider that is, stay away, keep your distance. In the public, your family, at home, when you're on transport, when you're in a shop, when you're at church, wherever it might be, stay away from people who might be at risk. Stay away from public gatherings. It is simply not worth it. It is simply not worth the risk. Protect yourself in public areas. Of course, everybody knows how to do that. Wash your hands properly. If you implement all of these measures that we're talking about here in the workplace, chances are that if workers that in your workplace get infected with COVID-19, it will be because of an exposure outside of the workplace. They should not be exposed to COVID-19 inside the workplace. It should be from outside. And it is very important that people should be aware of the risks all of the time. that everybody suffers from COVID fatigue. Everybody just, sometimes you just feel like you just can't be bothered anymore. The moment you feel you can't be bothered anymore, believe me, COVID-19 is going to start bothering you. COVID-19 does not get fatigued. It does not get tired. It does not think, okay, I've bothered these people enough now. It will start bothering with you. So it is important that all of us must protect ourselves and must protect ourselves from others. Wash your hands regularly. Don't touch your face. Wear your mask. These are important things to protect yourself. How do you protect others from you? Maintain your physical distance. Don't touch other people. Monitor your own health. People must take responsibility for their own health and well-being. If you feel unwell, if you've got symptoms, don't be resistant to the idea that you might have COVID. Don't go and think, please, just not this. I'm just going to wait and see what happens. Act on it as soon as possible, because the sooner you act, the sooner you know for sure, the sooner you can take the correct measures in order to protect everybody else from you. Wear your face mask whenever you're in public, whenever you're in contact with another person, and keep masks and clothing clean. Most people now use disposable masks. A disposable mask is disposable and should not be used for weeks on end. The same mask without disposing it and using a fresh mask. It's important to launder masks if you use cloth masks and clothing regularly, especially people who use protective clothing inside the workplace. Enable it once again inside your workplace. Right, so communication, that's the last thing. Worker communication. Make sure that people believe and know what is true. Make sure that you put through the right kind of messages to people, that you get the facts to them. Make sure that you jump on the back of every loose rumor and piece of fake news out there as if it is a wild stallion, and rein it in right there. And make sure that it does not start fires amongst your employees. People talk, people like especially exciting news stories that they feel they're the only people that know. Remember always that analogy, fake news, conspiracy theories is like IKEA furniture. It might be a crappy old thing because you built it yourself and it's a bit skew and it's a bit wonky and it doesn't really work all that well, but you do love it because you built it yourself. Same thing with conspiracy theories. Might be a bit wonky, it might be a bit skew, might be completely and utterly untrue, but because you thought of it yourself, you think it is true and you really love that theory. So this is very important, that you must make sure that you're on top of these things, that you understand what people are saying, that you're aware of what people are saying to each other, what rumors might be doing around, and make sure that you're always counteracting that with the real facts and the truth, both for COVID-19 and especially for vaccinations. Make sure that people have access to the facts. Make sure that people understand what they should be doing, what they shouldn't be doing, what's allowed, what's not allowed, that they know what's in the regulations. The regulation requires that you inform your workforce about the regulations, about the directions, and that they're aware of what's in there. Make sure that you do this. Make sure that people understand what they should and shouldn't be doing in the workplace. You need to encourage communication between supervisors and their teams. You need to make sure that it happens regularly. You need to make sure that you're reinforcing and enabling and encouraging compliance continuously. This is not a once-off job. This is an all-the-time job. This is why we have daily inspections, why we have monitoring sheets, etc., etc. Make sure that you do that all the time. And that makes sure that workers know how well they're doing, know whether they're complying or not, that you give immediate feedback, that people are aware of this. How do you communicate with your management? Management needs to know what they're supposed to do and what they're not supposed to do. The worst possible thing you can have is a manager walking around the workspace without a mask on, or hugging people, or patting them on the back. Managers need to understand, especially top management, need to understand what kind of impact, how visible they are. They need to understand that they need to be especially careful when it comes to how they act when they're in the workplace. It is not a show of strength to make as if you're invulnerable and walk around without a mask. It is extremely irresponsible. And managers need to understand that. Make sure that they're engaged, that they're involved, that they're part of the team talks, that they're also communicating to workers, that they are aware of people who test positive in the workplace, that they are commiserating, that they're checking up on those people. Make sure that they're involved in this process, that they're reinforcing the messages, Make sure that if there are changes to the workplace plan, if you're not responsible for putting that plan together, make sure that you're aware if there are any changes. So if there are changes in the regulations, etc., if there are changes in the risk mitigation strategies, make sure that you're aware of that. And then, of course, also you need to make sure that there's good communication between you and the procurement department to make sure that there's sufficient PPE, cleaning equipment, supplies, etc. All of this, that there's sufficient stocks of all of this on hand, that you don't run short all of a sudden. Don't have to stop at the Shell to buy a bit of sunlight. So stakeholder communication, you need to make sure that you also communicate externally, that people, customers, clients, receivers in overseas countries, export agents and so on are aware of the measures that you've got in place, that there's comfort on their side, that they've got a sense of comfort about the measures that you've got in place in your workplace, not only to protect your workers, but also to protect the product, to make sure that they are confident that they will not get contaminated or in any way compromise products from you. Make sure that is there. Make sure that you are communicating also to your suppliers, to service providers, that they're comfortable that you are managing your workplace well. All of this is empowered through daily inspections. You can have all the measures in the world. If you're not monitoring it and you're not inspecting, then it is a piece of paper that is sitting in a file. You need to be making sure that people comply every day. List your critical control points. Make sure you understand whoever's doing the daily inspection, which should be you, the COVID compliance officer. It's part of your job. Do your daily inspections. List all of your critical control points. If you have people helping you because it's simply too big or for whatever reason, make sure that they all understand what are the control points, what should be happening at each of those, what are the limits, what are the tolerances, and how do they manage that? How do they inspect those particular control points? Make sure that all of this is documented. Then make sure also that supervisors and team leaders have the authority to enforce compliance. That is not a question of, oh, I'm going to tell the CCO if you don't do what you're supposed to do. No. Team leaders, supervisors must have the authority to enforce compliance and to get people to, and they must have a mechanism for reporting non-compliance without that feeling like tackling. There should be a very, very transparent mechanism in place where they are able to report to you if there's non-compliance in their area. You also don't want people to be only compliant when you come walking by or when they know that you're doing your daily inspection, because it always happens at 10 o'clock in the morning. Therefore, so of course, regular inspections, it's important for them to be regular, but don't make them the same time every day. Make sure that you're able to monitor that people are also complying when you're not present. So scheduled and unscheduled inspections. So what do you need to do? Check the sanitizing schedules, the screening sheets. Make sure that if you pick up on screening sheets, if there's anybody there that might be symptomatic. Make sure that shift schedules that being implemented, complied with, that people are maintaining physical distancing, there is no crowding and congregation, that all of that is as it should be, and that of course that hand washing and sanitizing stations are well supplied, and that people have everything they need to in order to comply. Okay, so what do you do if you have a person either at screening or in the workplace, or if you have somebody that is at risk? So let's look at at-risk people. So what is an at-risk person? First of all, people who have at least 2 of the common symptoms: sore throat, dry cough, shortness of breath, loss of taste or smell. Not and smell, doesn't have to be both, either smell or taste. If they have 2 of these 4 symptoms, they are at risk of having contracted COVID-19. Either that, or somebody that have been in close contact with a person tested positive for COVID-19. So either they've got symptoms or they have been in contact with a person who has tested positive for COVID-19. So close contact, that's important though, close contact. This doesn't mean walking past somebody in the supermarket or, driving past them in your car. That is not close contact. Close contact, and this is according to the DOH guidelines, the Department of Health guidelines, is more than 15 minutes, not wearing a mask, at a distance of less than 1.5 meters. That is close contact. If you've been in contact, if a person has been in that kind of contact with a person who is tested positive for COVID-19, then that person is considered to be at risk, whether they're symptomatic or not. So what do you do? Okay, first of all, there's 3 different places where this can happen, and there's different actions that you should take. Let's say it's at an access point. PT arrives at work, and he has got symptoms, or PT arrives at work and he says, all right, because again, remember, you're encouraging disclosure. You don't want people to have been in contact with a person who tested positive for COVID-19, but you treat people so badly if they have exposed themselves in this way that now nobody wants to ever tell you again if they've been exposed. So it's very important that you must encourage disclosure, that you must keep a positive feeling around this. So PT arrives at work, he says, sorry, very sorry to say, but I just found out that, you know, I spent yesterday, last night or Tuesday night with my cousin, and I just heard that he tested positive for COVID. Right. What do? First of all, you deny access to that person. You do not let them into the workplace, not to fetch something from their locker or to quickly go and greet their mate or to do anything else. You do not allow them access to the workplace. Secondly, if it is a worker, if it is one of your own people, you arrange for that person to be taken to a testing facility while maintaining protective protocols. So you might get a driver to take them to a testing facility in the car, all the windows open, masks in place, everything you need to do in order to protect anybody else that they might come into contact with, and you take them straight to a testing facility. You then instruct that worker to go home and to stay in isolation until they've received the results of their test and to monitor their symptoms. That's what you do. So they go for testing and they go straight home and they stay there until they've got their test results. If it is a service provider, a member of the public, a customer, etc., you inform the company, but you deny access to that person. You do not allow them onto your premises. Second thing that can happen is that worker, it's a worker of yours, they're already at a workstation. Now all of a sudden they arrived at work this morning, they were feeling fine, they're sitting at work, they're working, all of a sudden they start just feeling awful. They start coughing, sore throat, etc., etc. The other option is that they're sitting at their workstation, they get a phone call and says, and PT hears that Yanni, his cousin, has got COVID. Just heard that he tested positive for COVID, and they spent Tuesday night together. What do you expect from the worker? First of all, the worker immediately has to inform a supervisor, or he has to inform you. This is why it's so important that your workers, that everybody must understand exactly what they need to do and what this is all about. So they immediately inform you, they immediately inform their supervisor. What do? You isolate that person. That's why you need that isolation room. You put that person in the isolation room. You make sure that they've got PPE. Make sure that you always have some surgical masks on hand, either surgical or N95 masks on hand. So you have higher grade masks on hand, immediately give that person a higher grade mask so that they can put that on. Arrange for that worker to be taken to a testing facility. Once again, make sure that protective protocols are maintained, and you instruct that worker to go straight home and to go into isolation to monitor their symptoms. You then go and assess the risk of infection, and you disinfect the work area if necessary. Not the entire building, not the half of the hemisphere. You don't have to do an exorcism. You don't have to stop people working, send them all home. All you need to do is to see where that person, the areas where that person might have been that day, so mostly his workstation, maybe the bathroom, maybe the kitchen, etc., and clean those areas to make sure that there's no risk of infection from that very tiny risk of infection from surfaces is brought down to 0. You then need to do contact tracing, and you need to assess the transmission risk. So you need to identify the others in the workplace that might be at risk. So who are the people that person who is now considered to be at risk? Who are the people that person might have been in contact with? At this point, all you need to do is just to gather that information, understand who they were in contact with, and understand the nature of the contact, whether it might have been high-risk contact. But you don't have to do anything else until you know the results of this person's test. This person isn't positive. You haven't proven this person have got COVID. You only think that this person is at risk, and this person might be at risk, and you've sent them for testing. Right. So What do you do? The other way that it can happen is a sick phone in. Somebody phones you and says, I just feel terrible, I feel awful. Now, look at your procedures for that. If your regular procedure in the workplace is for a person, when they do a sick phone in, to speak to a supervisor or a manager, change that for the time being so that they speak to you. That is ideal. If it's too much, designate another person that's particularly responsible for sick phone-ins and know exactly the questions to ask and exactly what to look for. So this person phones in, they say, oh, I've bumped my toe, or I cut my finger, or I burnt my hand, I can't come to work. That's fine, nothing to do with COVID. Fine, okay, get a doctor's letter, whatever your regular procedures are. If, however, this person says, man, I'm just feeling awful, I've got a cough, whatever, you know what the symptoms of COVID are, you know what the right questions are to ask. Then what do? You question the worker, you assess the risk of that being related to COVID. If the person is considered to be at risk, you tell them to go for testing and to self-isolate. And you tell them that they don't return to work before they've received their results. Right, so that's what you do. That also, a person can of course also phone in and say, I'm going to stay at home because I've been in contact with another person with a person that's tested positive. In that case, that's a very responsible thing to do of that worker. You congratulate them on their fortitude, and then you tell them to self-isolate and to go for testing and not to come to work until they've had their test results. Okay, so just two little things that we need to understand. First of all, do not ever, and this is in the regulations, this is law, no person can be discriminated or should at all be discriminated against for having exposed themselves to COVID, for possibly having COVID, for being at risk, or for testing positive for COVID. You will not discriminate against the person. You will not treat them badly or blame them for getting sick or blame them for. There's only one villain here, and that is COVID-19. No person, even if you think they were responsible, tough luck, that is irrelevant at this point. What is relevant is that person is sick, might be sick, might have been exposed, and they need your assistance, your help, and your support. That's what they need at this point. Secondly, if a person has been identified as being at risk, either through a sick phone-in, at the access point, at the workstation, they will not come into the workplace until they've had their test results. Even if they phone you tomorrow and say, oh no, I'm much better. It was just an allergy. I just, had a bit of sniffles yesterday. There's nothing. I'm much better. I'm just 100% now. Once they've gone for a test, they will not come back into the workplace until they've got the test result. That's it. That's the rule. That's what we'll stick with. So if a worker informs you that they've tested positive for COVID from a test conducted, after they've been identified at risk, they should not have been in the workplace since being identified as being at risk. That's very important. That is a golden rule that we must all adhere to. So what do you do? Is 3 sets of actions that you need to take when somebody tests positive. When somebody phones you to say that they, first of all, get a written confirmation of the positive test. It's important that you have that for your records. You need to then report it through the OHSS. We will look at that a little bit later, the whole data collection and data submission process. Then you need to instruct the worker to self-isolate for a minimum of 10 days. So that's the rule, 10 days now. You also need to, if they're not clear on what does it mean to isolate, assist them with that. It's in the guidelines. What does it mean to self-isolate? Assist people, make sure they understand 100% what they need to do. They need to monitor their symptoms, make sure that they understand what they need to do if it gets worse. So if their oxygen levels drop and so on, make sure they understand what to be on the lookout for if their condition worsens. If they need to get medical assistance, make sure that they can do that. And then if that worker does not have sick leave that they can take, please help them on the return to work, or help them then to apply for UIF. There is TERS UIF that people can claim if they get COVID-19, if they have to take time off because of that. So please help them to apply for that. The second set of things that you need to do is, remember, you've got your list of people that worker has been in contact with, if that worker was in the workplace. Now you need to go and determine whether that was high-risk contact or not. So you need to go and look at, more than 15 minutes without a mask, less than 1.5 meters apart. So was it high-risk contact? If it was high-risk contact, you need to tell everybody that was in contact with that person to stay at home. They are now become at-risk people. So you need to go home, get tested, and they need to self-isolate. Then, if it was a low-risk contact, those people can stay at work, but they need to just monitor their symptoms to make sure that they are safe. Action 3, you need to investigate where and how the worker was infected. You need to report this information as well through the OHSS. So you need to understand whether it was a workplace, whether it happened in the workplace, or whether it was outside the workplace. If it was at the workplace, you need to go and investigate why. You need to go and look at your protocols. You need to understand whether it was a breach of protocol, so whether somebody did not adhere to the measures and why that was. You need to remind them that everybody that is involved, or what are the measures, what are the protocols. You need to understand why it was breached, and you need to make sure that doesn't happen again. Take disciplinary action if necessary. Then, if the protocols were not effective, so if there was a workplace transmission because your protocols, your measures are not sufficient, then you need to go and revise your plan. You need to go and look at what you need to change in order to put better protocols, better measures in place. You need to communicate all of that to all of the workers so everybody understands what they need to do differently. Then lastly, you do need to report it to the compensation commissioner. So if it was a workplace transmission, there's provision from the compensation commissioner for an injury on duty claim. So a person can put that, so you need to report it to them, and you need to assist the worker with that IOD claim if it was a workplace transmission. That will only be a work though, and that will only be applicable if you can prove that it was a workplace transmission. Okay, so when can a person return to work? 10 days, that's the rule now. They need to be in isolation for at least 10 days. So even if they don't have a severe case, they're just a little bit sick, they still need to be in isolation from 10 days. Now, 10 days counting from when? 10 days from when they become symptomatic. All right, so a person who develops symptoms, it's 10 days counting from the day when they first developed symptoms. If the person is asymptomatic, so if a person was in contact with another person that was positive, went for a test, it's positive, but they themselves never really develop any symptoms, it is counted from the day when they tested positive, 10 days from that day. So people then can return to work after 10 days of being in isolation. If they had a moderate or a severe case, so if they were hospitalized, or even if they were just under medical treatment, they also need to undergo a medical examination to confirm that they are fit for work. You need a fit for a certificate that certifies that they're fit to return to work before they are allowed back into the workplace if they had a moderate or severe case. This, of course, also will take into account the kind of job that the person does. If they do very hard physical work, they might not be fit to do that. They might be fit to do some other work, but not hard physical work. So you need to take that into account, especially people whose respiratory systems were compromised as a result of the disease. Once back at work, ensure that people are still, this idea that once you've had COVID, you can't get it again. We are now seeing people who are getting COVID for the second time. So people who are getting it, even if they had it in the first or the second wave, they are getting it again now. So it's very important that you must please make sure that people still maintain all of the protocols that are in place in the workplace. The worker then also, according to the guidelines, have to wear a surgical mask for at least 14 days after their diagnosis, so that's after after testing positive. So they come back to work after 10 days. For 4 days more, then they do have to wear a mask. A surgical mask, not just a regular one. Everybody has to wear masks, regular masks, but they have to wear a surgical mask. So make sure again that you have those in stock and that you can supply them to a worker. Right, so let's look a little bit about vaccinations then, and about regulations, and about requirements around that, and best practice around that. First of all, do all you can to assist and speed up worker vaccination. It is very, very important that you must take the best possible positive attitude towards vaccinations, and that you must assist and enable vaccination as soon as possible. The quicker you can do that, the quicker you can start feeling more comfort inside your workplace that people are in a position where they are less likely to be vulnerable to COVID infection. Distribute information, hold meetings, address fake news. Jump on them, jump on fake news, make sure you understand what people are talking about, hold meetings, explain things to people, show them videos. There are very, very good videos out there explaining how vaccinations work, how they were developed, what are the, why they are safe, etc., etc. Please do all of that, get that information out to your workers. Help workers to register. It's on vaccine.enroll.health.gov.za. It is a phased rollout of vaccination, so whenever your workers' age groups roll around, please make sure that you help them to register on the vaccination site. Consider making your own occupational health and safety facilities available for vaccinations. You can register your health facility through the Department of Health. Please contact us for more information on how to do that. But consider doing that. Of course, if you have a vaccination facility at your workplace, it's going to be much easier and quicker to get your workers vaccinated. And you're also not going to have to allow them that much time off to get vaccinated. Otherwise, if they have to go to the local clinic or to the local town or wherever it might be, you have to allow them time off to go and get vaccinated. And if necessary, help them with transport to get there. Workers who have been vaccinated must still adhere to all the protocols in the workplace. Screening, physical distancing, mask wearing, everything that's been put in place. Once the people have been vaccinated, even if every single person in your workplace has been vaccinated, it still doesn't mean that they can now just go bossies and do whatever they want. It is not the old normal. Once again, it is still necessary to maintain all of the protocols and to do everything. Those are the rules. Simply don't know enough yet in order for them to be able to say which, if any, of these protocols can be removed once people have been vaccinated. Right, so last thing then, record keeping and reporting. So these are the records that these are examples of the records that you would be keeping regularly. Screening sheets, your inspection roster and control sheets, your sanitizing records, all of these. You want to keep individual records of people who were considered to be at risk, for people who are positive cases. You need to keep all of this information. You want to prepare a weekly status report, not only for management, but also to report back to teams, to your staff, so that you can tell them how we're doing, what progress are we making, are we better, are we worse, etc. So you want to keep all of these records and you want to keep them safe. Then you need to also be submitting data on the OHSS. So it's the Occupational Health Surveillance System. It belongs to the National Institute for Occupational Health. It runs through them. So this is compulsory for you to submit this data to them. They use this data to monitor where in the country there are outbreaks or where COVID is more prevalent. They need to understand how it is spreading, whether in workplaces or through contact and so forth. So this information needs to be submitted. Now, what information? The first thing, of course, you need to do is to register. You go to this business portal, this business portal website, you click on to register for as a business, and you then get a unique business ID. So this information is all in this guideline submission of COVID-19 related health data. So please go and read that guideline, understand exactly what it says. So what kind of data are we looking at? There's five categories of data that you have to submit. First of all, vulnerable worker data. So once you've done your worker classification, you will submit this data to through this business portal. There's a template for this that's available in CSV. There's also in this guideline, you will see the template, all the information that you need to gather, that you need to submit. There's also a CSV, Excel CSV file template that you can complete and send that to them. So this is submitted once off, and then whenever there are changes in, if you become aware of a new vulnerability, or if you appoint new workers, you will update this information, but that's a once off submission. Then daily symptom screening data only for symptomatic workers. So if you do find or workers who are symptomatic when they pitch up at work or at the transport vehicle, then you must submit this information through the system. That is on a weekly basis, so the Tuesday of every week for the week before, starting on the Sunday the week before, you will submit that data. There's also a template available for that. Then COVID-19 testing data. So if you have an employee who is positive, you need to submit that information. There's once again a template for that. And as part of that, then workplace contact tracing. So in this template, you will also see there's then information about the high-risk contact data that you need to submit as part of this COVID-19 testing data. The last thing then is post-infection return to work. So if you've had a positive case, you need to complete this template once a person has returned to work. It contains information such as how long was the person off, what was the serious case, a moderate or a not so serious case, whether the person was hospitalized, etc. So all of this data needs to be submitted. The templates are there. We're also making these templates available to you so that you can complete them and submit this data through this portal. Okay, so what do you do in cases of non-compliance? We're in the final section of the course now. What do you do if there is non-compliance? Don't jump up and down, take positive action. First of all, you need to give constant feedback. Something as simple as workstations, as a simple robot system, as in green, we're doing fine, we're compliant, we're just in a good position. Orange, hey guys, things are wobbly, we're not 100%, we can improve. And red, as in this is a mess. Come on, guys, this is nonsense. So a simple robot system at every workstation is very helpful to give visual, immediate feedback to people. So people always know exactly where they are. And that also encourages them to improve. People always want to win. They always want to improve. They always want to score a higher score. That's why video games are so popular. So simple feedback system at workstations is very effective in giving feedback, constant feedback to people and encouraging them to improve on their compliance levels. If they are not complying, so if a team is not complying, talk to the supervisor, talk to them, and keep a record of those feedback sessions and make sure that the supervisors, team leaders fully understand how they are not complying and what they need to do in order to improve. If that doesn't help, you need to escalate it. And you need to escalate it to senior management. They need to provide corrective feedback, so they need to have a meeting with them, explain to them exactly what the problem is, and encourage them, tell them exactly what they need to do. Again, keep a record of that feedback session. If that doesn't help, disciplinary action. You'll need to take action to individuals, to groups of individuals, give them written warnings, make sure that this is not something you can just let go and just go, oh guys, come on man, we need to try harder. This is life and death stuff. You need to take disciplinary action, you need to take strong action in order to ensure compliance. Non-disclosure is a massive, massive problem. As I said before, you need to do everything you can to encourage disclosure and to enable and encourage compliance. This is very, very important that you must do this. But if you do find cases of non-disclosure, for instance, if a person has been in contact with a person who tested positive for COVID, or non-disclosure if a person has a comorbidity that they did not report, that they didn't own up to, etc. Non-disclosure is one of the greatest dangers that you face, and it's one of the things that can really, really cause havoc in the workplace. So that very, very serious action in cases of non-disclosure. You don't want to be punitive, as I said before. You want to encourage everything you can do to encourage disclosure, but you need to make the penalties for non-disclosure high as well. So remember, people respond to positive to feedback, and they will correct their behavior. Make sure that you're there, that you're present, that you keep correcting, guiding, coaching, mentoring. Keep your eyes open. Your feedback, immediate, direct. Don't see that a person is not wearing a mask, and on Friday when you have a team meeting, you come down on that person like a ton of bricks. Immediately go up to that person and says, no. You know that's not the right thing to do. So keep it immediate, keep it direct. Make sure that people understand what they're doing wrong and what they need to do in order to improve. How will you know whether you're effective and whether you're doing a good job? Your performance will be determined by how much you know. You must know the guidelines. You must know the industry guidelines. You must know your workplace plan, your risk assessment, your workplace plan. Be involved in it. Be aware. Be absolutely on top of these things. You need to do what you need to do. You need to implement all of the measures. You need to communicate. You will be measured by the number of workplace transmissions. Your target is 0. There shouldn't be. If you implement all of this, if you really are honest about the risks at every control point, and you do what needs to be done, you put measures in place the way that you need to in order to mitigate that risk, you should not have any workplace transmissions. It's not to say that nobody in the workplace will fall ill, because people go outside and they can bring it into the workplace, but you should not have any workplace transmissions, even if a person brings it in. Your approach will determine your effectiveness and performance. Your approach need to be confident, knowledgeable, know what you're talking about, assertive, calm, helpful. Don't throw tantrums, don't jump up and down. Just be assertive, calm, helpful, positive, rigorous, consistent. These are the things that will help you to be effective. Right. And then, in conclusion, make sure that you're informed, get your house in order, enable compliance, encourage disclosure. That's your mantra. Establish preventative habits in the work teams, drive compliance, inspect and communicate daily, and complete your admin and your record keeping meticulously. You don't want that to be fall behind. Right, okay, so that then is the course. Here's a few very useful contacts. The Citrus Resource Warehouse is the go-to place. You can find regulations, guidelines, workplace resources, templates, this presentation, all of it you'll find there. You will also find a recording of this course on the Citrus Academy YouTube channel, so you can go and have a look there. For general information, very good sources of information, sacoronavirus.co.za, that's a very, very good source. The NICD, that's the National Institute for Communicable Diseases, their website, and the National Institute for Occupational Health. And then cdc.gov is the Communicable Diseases Institute in America, and that is a very useful information, a source of information for scientific information about COVID-19 as well. Go and read what they say, read their articles, read everything they've got on there. Emergency hotline, you've got that. The WhatsApp support line, that's the Department of Health WhatsApp support line that you can put there. And then you can keep contact with your Provincial Department of Health and your Department of Employment and Labor. Those are useful contacts to have. For industry-specific information, the CGA does a COVID memo every now and again, normally on a weekly basis. If there's a wave going, you can find them also on the Citrus Resource Warehouse or on cga.co.za. All of this is useful information. Whenever there's new information and guidelines coming out, this is where they will be posted and where they will be uploaded. All right, that's the whole story. Thank you very much, everyone, for attending today. I hope that you found value in this. Please feel free to get in touch with us, to go to our website, to contact us through there. If you have any further questions, if there's anything else that we can be of assistance with and that we can help you with. And in the meantime, good luck, and I hope that you are successful in your work as a COVID-19 compliance officer.